One of the things we cover on our show, America's Healthcare Challenge, and as we were helping people at Bellis, is all of these issues I'm going to talk about as you try and navigate the complexities of the American healthcare system. There are certain themes that kind of jump out at all of us, and we're going to take a moment to talk about some of those themes right now because the state of healthcare in the United States has been a topic of debate and concern for many decades, faces numerous challenges, has left many patients providers feeling lost in this complex and confusing maze, and the government doesn't make it any easier when they pass new legislation. So, some of the issues that we like to cover and talk about on our show, America's Healthcare Challenge, which, by the way, thanks for watching this video. Please subscribe to this video and check out the show's page, America's Healthcare Challenge, on SoundCloud, iTunes, and YouTube. We talk a lot about the rising cost of healthcare. One of the most significant issues plaguing the U.S. healthcare delivery system is the ever increasing cost of medical care. Healthcare expenditures in the United States are among the highest in the world, with millions of Americans struggling to afford essential medical services and medications. Medical costs are one of the number one causes of bankruptcies in the United States. And we talk about how to control costs, understanding the risks of costs, meaning what are the things that can lead to higher costs, and look at where these high costs are coming from, whether that's pharmaceutical companies, the lack of transparency from healthcare providers, not enough competition, and so on and so forth. Another area of concern that we find is access to healthcare. Access to healthcare is a concern for the United States because millions of Americans still lack adequate health insurance coverage. Now, the Affordable Care Act went out to provide coverage for everybody, and it's done some good things, but in many cases, folks are underinsured, meaning that they have insurance, but they simply don't have enough money in the bank to cover the deductibles if they did have a catastrophic event. So this is an issue that we still need to continue to look at, and we discuss these challenges on the show. We also talk about fragmentation of healthcare. Navigating the U.S. system can feel like piecing together a puzzle with missing parts, and fragmentation of care, where patients receive healthcare services from various providers and institutions, may sometimes feel the same way. It can lead to a disjointed and inefficient care delivery, particularly in rural and urban underserved areas. And we always look at those things, and we also cover these things on our website, edbellis.org, on our blog page, so make sure to check that out. Another area of concern in U.S. healthcare is healthcare disparities. Healthcare disparities persist, and they affect the marginalized populations. This can include, minority populations disproportionately. Factors such as race, ethnicity, and socioeconomic status, as well as geography, can lead to disparities and poor healthcare outcomes, as well as poor access to care. So we talk about the root causes of these disparities and some initiatives that are put there to try to address them. We also talk about technological advancements. Advancements in healthcare technology offer both promise and challenge. Electronic medical records, telemedicine, artificial intelligence, they're all transforming the way healthcare is delivered and managed. So we discuss all of those issues, and we talk about how it's helping shape the future of healthcare, as well as its potential to improve patient care and reduce costs. We also talk about the role of government in healthcare. Government policies play a significant role in changing the U.S. healthcare system. We will explore these. We continue to explore these. We've been doing the show since the ACA was passed in 2010. So we look at laws like that, the Inflation Reduction Act, and other laws to understand how they affect you as these changes come down from public policy. We also talk about how you can take an offensive role in managing your healthcare. So that would be patient advocacy and empowerment. In the midst of America's healthcare challenges, patient advocacy and empowerment have become increasingly important because of all the bureaucracy in the system. Frankly, a lot of people just kind of wanting to push things off their desk. Sometimes you really need to be an advocate for yourself, and we highlight the role of patients in advocating for their rights, helping you understand how to seek affordable care and make the right decisions. And then finally, we also talk about different unique creative solutions out there We bring in industry experts, and we also explore news articles talking about these solutions, because while the U.S. faces some complex issues, there are potential solutions and strategies for improvement. And we continue to explore issues like value-based care, preventive medicine, healthcare innovation, and other things to address the challenges we're facing in the system. So if you're looking for something to listen to on your next walk or in your car or while you're working out, consider America's Healthcare Challenge, because the United States healthcare system is undoubtedly a maze filled with twists and turns. But understanding the issues like the ones we just talked about is the first step in finding a way out. And so in our upcoming series, we will be taking a deep dive into these issues and help you understand more about them. Please subscribe if you want to learn more, and to enable those notifications to get these posts as they come out regularly. Thanks so much for watching. I will see you on the next video.